to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Karen Sepucha. She is a research scientist, and she wrote the Kevin MD article, "We Must Help Patients Recognize How Important Their Opinions Are." Karen, welcome to the show.
Thank you. Very nice to be here.
We'll get into the article in a little bit, but first off, can you share your story and journey to where you are today?
Sure. So as you mentioned, I'm a research scientist. I actually am the director of the Health Decision Sciences Center at Massachusetts General Hospital, and I'm on faculty at Harvard Medical School. So my work broadly is focused on trying to improve the quality of medical decisions. And I fell into this area as a PhD student in engineering. I was really drawn to one of the core components of our engineering program was decision analysis. And while some of my colleagues went off into doing very sophisticated mathematical simulation models, I was really gravitating towards applied work, thinking about, how do people understand risk? How do we cope with uncertainty? How do we communicate and collaborate with others when you can't make these decisions alone? And so those are the things that always got me very excited. And medicine is full of these kinds of situations, difficult, tricky, thorny decisions. And so I did a couple of, early research projects in medical decision making, and then I just got hooked, and I haven't looked back since.
So tell me, what are some of the obstacles that prevent patients today in general from making good medical decisions?
Well, there's certainly many obstacles. There's, I think figuring out how do you get good information? Where do we find information? Sometimes there's too much information or information overload. So I think that's always a challenge, is figuring out, where are the trusted sources of information. And then the other challenge, which I think came out in this piece, is really just a lack of a recognition of how important and what patients' expertise is, what they bring to this. I think some people think that medicine as a science has all the answers. We just need to find that right expert and they will tell us all the answers. But really, a lot of medicine is about understanding and tailoring things to who this person is, what they care about, what matters most to them. And so understanding and helping patients feel comfortable talking about what's important to them, thinking about how they feel about these different potential outcomes is, really some of the challenges I think that make it hard to do these decisions well.
So let's talk about that in your Kevin MD article titled, "We Must Help Patients Recognize How Important Their Opinions Are." Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so the story of why, I think comes out from maybe dozens of years of my husband nagging me about taking some of the cases and stories that I kind of would share at dinner and putting them into a more accessible format. In my job, I write a lot of research articles that, go into public peer-reviewed, medical journals, and maybe 12 people read them. But those articles, the goal really is, be very objective, don't have an opinion, and let the results speak for themselves. And so this article kind of came about, actually, it's a result of a project that I've been working on. MGH had started this group, a Public Voices Fellowship, and it's working with the op-ed project. And so they are working to help people think through how do you get your voice out? How do we get these stories out to different audiences? So, I was really excited. This was my first attempt to do that, and it found a home, with Kevin MD, which I was pretty excited about. So that's sort of the genesis of why, where this kind of came from. So the article starts with, so for folks who haven't read it, it starts with a kind of random but fun example about a crocodile. And really the reason to bring that in is just to illustrate how easy it is that we make assumptions about what others might want or need, and just to kind of take a step back and raise some questions about whether or not we get that right. I think that when we make assumptions and place our values onto others, I think we have to be very careful about that because they might feel differently. And I think the parallels to medicine and the patient-physician relationship and making decisions in medicine are many. So, what we talk about in the article is, it's really focused around actually a breast cancer patient that I had worked with. And we were talking about how she made the decision to have surgery. So many breast cancer patients thinking through, do I have a mastectomy? Do I have a lumpectomy? It can be a sort of challenging situation with a new diagnosis that is scary. And we were talking a bit about what was most important to her, what was she most concerned about, what kinds of things made her life worth living. And after a few minutes of our conversation, she kind of stopped and was like, oh my gosh, I did this all wrong. And so I asked her, like, what are you talking about? What do you mean you did it all wrong? And she said, you know what? I asked every single doctor I saw for what they would do if it was their wife, what would they would do if it was their mother, and she's like, but their answers now are kind of meaningless. She's like, because I didn't know what their values were. I didn't know what made their life worth living, what their wife was like. So that information and that recommendation was kind of meaningless without that information. And then she said, you know what? Nobody ever asked me this when I was going through this decision process. So that really just stuck with me, that we're missing this really important, knowable information that would have such a big impact on decisions. How do we get that into the conversation? And it's not just that the doctors aren't asking, it's that the patients have no idea they should even be thinking about it. So it's sort of on both sides, there's just this gap in understanding how important it is to think about, where are the patients? What do they want? What do they need?
Just to get understanding in terms of the scope of the issue, do you have any data in terms of how often or not patients' values or experiences or stories are included typically in the decision-making process?
Yeah, there are some growing data on that. So it was a bit of a while ago, but there's been 2 national studies that have looked at the quality of the decision-making process. So these are studies that looked at sort of common decisions. So they looked at cancer screening decision for breast, prostate, and colorectal cancer screening, common medication decisions, for depression, cholesterol, blood pressure, and then surgical decisions, thinking about hip and knee replacement or spine surgery or cataract surgery. And what was neat about these studies is they actually asked the same type of questions for the patients and getting at sort of whether there was sort of shared decision making. So they asked, did the doctor talk about options? Did the doctor how much did they talk about the reasons to have this test or treatment? How much did they talk about the reasons not to have this test or treatment? And then they asked 2 other questions. One was, did the doctor make a recommendation? And did the doctor ask you what you wanted to do? And what they found pretty consistently across these studies and in these clinical areas was that doctors were twice as likely to make a recommendation as they were to ask patients what they wanted. So there's a big gap, in terms of whether or not patients are even being asked about this stuff.
And when you talk to clinicians and you talk about some of your findings about including patients' values or including patients in a decision-making process, in general, what kind of response do you get?
So it ranges. I mean, I think for the most part, they're trying to do it already, so I do think, that they really are trying to figure out how do I do this? And then I think the second response is, gosh, I have no time to do this. There's hardly enough time to even give out the information that I think is important. We have to talk about the options. We have to talk about the outcomes of these treatments. And how do I find time that it seems like the values is this third piece that gets left behind because they don't always know how to do that well. And they don't necessarily want to open the can of worms and dive into there. So, I think there are, certainly some challenges that we hear. And then, the other thing we hear is that they try, so often I tried to do that. I tried to do shared decision-making. I asked the patient what they wanted. And they looked at me with this blank stare and said, I have no idea, you're the doctor, you tell me. So I think the other thing is when patients aren't ready to do this, how do we help? So I think we find that doctors have, years of training, lots of expertise diagnosing diseases, but just not well trained in diagnosing patients' preferences and doing that within the constraints of short medical visits because we're always going to be there. So that's something that our group and our research tries to help build those skills and capacity.
This is something I deal with daily in an internal medicine primary care clinic. So what are some of the proposed solutions to some of the issues that you just brought up?
Yeah, great question. So part of this is thinking about what we can do to support patients sort of before, during, and after visits when they're making decisions. So we have tools, for example, that are available called decision aids, and these are educational tools. And it's a little different than sort of traditional patient education, which is usually like, you're taking this medication, here's a piece of information that tells you about this medication. So decision aids really set up a decision. So there are multiple options that are covered. They have outcomes, so they talk about the good and bad consequences of these options. And to the extent that there's good evidence, they will often actually also include risks. So what's the likelihood of getting that benefit, or what's the likelihood of having that complication? So if they are also really effective in communicating sort of that numerical information that can be critical to help people understand, okay, here's the benefit, but only 10% of people might have this, risk. So how do I balance that? And then a third component that are included in decision aids is something called sort of values clarification. So they really do start and help patients think through what's most important to them, how do they feel about these good and bad potential outcomes, and how might they use that to help them figure out which choice might be best for them. So one thing that I think has been really critical and helpful, and there's lots of studies about these kinds of tools, randomized trials using these decision aids that show that they really do help, is figuring out how do we help get that information to patients so that when they come to the visit, maybe we don't have to talk about all the information and we can really just talk about what does this mean for you? And how is your situation? Maybe the decision aid had some generic information. How is your situation a little different? And how can we really tailor everything for you? And so that's what we hear from the physicians who use decision aids is that's a really big benefit. It doesn't shorten the time in the visit. It just changes what you're talking about so that it's much more meaningful and you're really getting at much more sort of nuanced conversation with the patient, and they're much more prepared to have that good conversation with you.
So can you take us into the exam room, hypothetical case study where a patient would successfully use one of those decision aids and how the physician would use that decision aid into that visit? Any case studies that you can really illustrate that point?
Sure. So we've been doing a lot of work lately with some of our orthopedic colleagues. And so, I think a lot of folks are a little bit nervous sometimes going to see a surgeon. It's often the first time they'll be meeting the surgeon. So they don't have a, long relationship to sort of build on. And so we've worked to help get patients decision aids before an appointment with an orthopedic surgeon. And then when they go in to meet with the surgeon, for example, one of our surgeons says she usually just asks, did they have a chance to review it? Do they have some questions about it? And the decision aid talks about surgical and non-surgical approaches to, for example, knee osteoarthritis or someone with hip osteoarthritis. So thinking about whether or not to have a joint replacement. And so she'll usually sort of start by asking them any questions or concerns. What are they thinking about? Are they leaning towards, one of these options or another? And so if they're leaning towards non-surgical options, then she's going to have a much different conversation than if someone comes in and says, yeah, I saw that. I really think, I really want to learn more about surgery. And typically without the decision aid, she would have just talked about surgery. Like that would have been the normal spiel. So she really has used it to, sort of change the trajectory of the conversation and really base it on what the patient is interested in.
We're talking to Karen Sepucha. She is a research scientist, and she wrote the Kevin MD article, "We Must Help Patients Recognize How Important Their Opinions Are." Karen, for those clinicians who may not have the benefit of the decision aids you're talking about, what kind of questions could we be asking patients in the exam room that really can help elicit their preferences, values, and opinions?
So that's great. So one of I think maybe big lessons when we start talking about, how do you put this into practice is, thinking about, I guess starting with an invitation, not a recommendation. So a lot of times when we go and observe clinical visits, what we hear is doctors leading with their recommendation and then taking the time to kind of explain, well, why did they make that recommendation and what does it mean? So for example, the surgeon that we were just talking about might come in and say, looked at your x-rays, got really severe osteoarthritis. I think surgery is going to be a great option for you. And then talk about it. Maybe on the primary care side, I watched, looked at your labs, your blood test came back, your cholesterol is pretty high. I think we need to start you on a statin. And I think doctors often assume that patients will just speak up and let them know if that doesn't make sense or if it doesn't fit for them. But the other thing we find often is that studies show that patients will not contradict or disagree with the doctor's recommendation. So if you start with the recommendation and then explain it, then you've pretty much shut down the conversation. So we try to have people flip it and start with an invitation for a discussion about a decision and start with the questions about what matters most to you. What are you most concerned about? So if those are the two things you could ask, that, we'd start there. And then you can kind of build out around that in terms of, okay, so what would that mean for the kinds of options that we think are really going to make sense for you? What are the outcomes that I want to make sure that we cover? And then you kind of end with a recommendation. So, I think the other thing that we hear from physicians who are trying to do shared decision making is, oh, then I just left it up to the patient. So I told the patient to go home and call me when they figured it out, the decision. And that's not really the point either, because the shared part is, that I think they do want your advice they do want your expertise. They do want help integrating all of this. But what we want to do is have that recommendation and the rationale for it shared with the patient, and reflecting that really reflects that I've listened and heard what you've said, and here's why I think this path or this option might make sense to you.
One thing I found is that the majority of patients certainly do want to speak up and share their values and have a say in the shared decision-making process. Do you find that there's a subset of patients, like you said before, you're the doctor, I'll do whatever you say. Do you feel there's a subset of patients who belong in that group, or do you feel like all patients want to be involved in a shared decision-making process and those subset just need more time in terms of making their voices be heard?
So I think the studies do suggest that most people want to be involved, but what that means really differs. And so, I think what we want to be careful about is not placing the burden of decision-making on top of people who already have a burden of potentially being in pain, being scared with a new diagnosis. So I think really that shared part is very important, that this isn't about you telling me what to do, what you want to do. And that can be a very daunting question. What do you want to do? Well, I have no idea because I don't understand the information. Could you help me understand that information? Could you maybe even target some questions that would help you figure out how to make that decision and where I might fall? So I think there's a lot of evidence that patients want to know what their options are. They want to know what to expect. They want the doctor to take into account their goals and preferences, but they don't always want to make that decision. They want, but they want the doctor to kind of tailor it to them.
So you mentioned a few resources. Where can people find these resources?
Yeah, great question. So up in Ottawa, they have a decision library, so a library of decision aids that are available for lots of different tools and things that are freely available. Our website has some decision aids that are available freely on it, as well as some links to training programs for folks who might be interested in getting more specific training, as well as some videos. So we have done, as part of trainings, videos of what does it look like, when you're doing shared decision making. So we have those available on our website that I'd be happy to get you guys the links for.
Sure, I'll share those in the show notes. And my final question: what are some of your take-home messages that you want to leave with the Kevin MD audience?
Let's see, great question. So, probably the take-home message here, when I think about, the core message of the piece, there's this cartoon on my mom's fridge that I think kind of sums it up pretty well. So it's a picture of these kids who are playing on a playground, and just about all of the kids are in t-shirts and shorts. And then there's this one kid who's in a hat, a winter jacket, and a scarf. And the caption sort of reads, these friends are asking why this kid's dressed this way. And he says, "My grandmother was cold." So I think we're all kind of familiar with sort of well-intentioned people who have completely different views than we do. And so they're kind of, so the take-home message, I think, for the listeners is to treat others as they want to be treated, recognizing that might be very different than what we would want or choose for ourselves.
Karen, thank you so much for sharing your time and insight. And thanks again for being on the show.
Yeah, thank you so much for having me.